Frequently, I hear complaints from the clinical team that the appointment coordinator schedules patients in what I call the mystery column. This column is really not in the template. You do not actually have a chair to put the patient in, and no particular clinical assistant is assigned to the column. This is what is typically called overbooking the schedule. When the orthodontic assistant sees that the mystery column has been scheduled, they immediately start talking behind the scenes. Their level of stress increases because they are not sure who is going to take responsibility for these extra patients. Immediately they start to feel a sense of overwhelm. Another challenge that affects the clinical team is when repair appointments are squeezed into the schedule. By this I mean that a longer repair appointment is scheduled in a 15-minute slot. The clinical assistants know they won't have time to take care of the patient and do the repair without a higher level of stress. For example, the patient may be scheduled for a quick repair, but actually needs 3 brackets rebonded. At this point, the clinical team feels frustrated because they feel that the patient was not properly questioned in regards to what type of repair appointment was needed. The next potential conflict for the clinical team is the late patient. Late patients are a big concern for the clinical staff because they want to stay on schedule. In some offices, patients walk in 30 minutes late and are just sent back to be seen by the clinical team with no explanation and no apparent concern for the schedule. These practices have no system in place to handle late patients. The after-school rush scenario is also a great concern for the clinical team. They may be sitting around twiddling their thumbs during the late morning and early afternoon, and then after 3 p.m. they are overbooked and have lots of patients waiting to be seen. This often creates a high stress level not only for the clinical staff, but for the doctor as well. They see all the names on the screen of patients waiting to be seen. The anxiety level goes up with each name that is added. Another thing that creates stress for the clinical team is when a 60-minute appointment is squeezed into a 45-minute slot, or a procedure that was not supposed to be scheduled after 3 p.m., for example, a 3-unit bond appointment, is scheduled at 4 p.m. The clinical team becomes irritated because they feel the appointment book guidelines are not being followed. When they have to do a 60-minute procedure in a 45-minute slot, they believe they are shortchanging the patient. Competing for the doctor's time is another source of stress for the clinical team. Quite often, there is only one orthodontist and several chairside assistants in addition to the new patient coordinator who all need the doctor. Sometimes the doctor is literally needed in 3 places at one time. The doctor who decides to have a busy, productive practice has to be aware of keeping their timeline in order with every patient. Vying for the doctor's time quite often creates conflict and stress between the new patient coordinator and the clinical staff. Another scheduling challenge occurs in the treatment area if one staff member is not pulling their weight. This scenario occurs when they are not doing the procedures in the allocated amount of time or if they are coming in late for work. They may be hiding out in the lab or taking personal phone calls. They may be up at the front desk chatting with the business staff and not with the patient when the doctor comes to the chair. Quite often, these behaviors go unaddressed, which creates conflict. The staff members who are working hard to stay on schedule and pulling their weight become frustrated about the fact that this team member is allowed to exhibit this behavior without any consequences. Take a moment now to review this list of potential conflicts which occur as a result of scheduling challenges from the clinical team's perspective. You may have to add to your list. Talk about which items apply to your team. The ones that I have mentioned here are the ones that I see most often. As I mentioned earlier, you have scheduling concerns from the clinical perspective, and you also have scheduling concerns from the front desk perspective. It is important for the entire team to understand where each group is coming from.